Welcome to Anatomy DAHAR series. Today's topic is lymphatic drainage of the tongue, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Introduction. The cancer of the tongue is common in people habituated to tobacco chewing. Because cancer spreads via the lymphatics to the regional lymph nodes, the lymphatic drainage of the tongue is of clinical importance. Some regional lymph nodes in the neck are submental lymph nodes, submandibular lymph nodes, jugulo-digastric lymph nodes, middle jugular lymph nodes, upper posterior triangular lymph nodes, lower posterior triangular lymph nodes, anterior compartment lymph nodes, and paratracheal lymph nodes. Locations of some lymph nodes in the neck. First one is submental lymph nodes, level 1A. This is the one. They are bilateral, located beneath the chin and inferior to the mylohyoid muscle. Some are superficial and others are deep to the investing layer of deep cervical fascia. Second is submandibular lymph nodes, level 1B. This is the one. Located in each submandibular triangle, between and above two bellies of digastric muscle. They lie on the outer surface of the submandibular salivary glands. Third is jugulo-digastric nodes, level 2, also known as the upper deep cervical nodes. This is the one. Located where the posterior belly of digastric crosses over the upper part of the internal jugular vein. Next is middle jugular chain nodes, level 3. Located along the internal jugular vein, inferior to the hyoid bone, deep to the sternocleidomastoid, and lateral to the strap muscles. Next is jugulo-omohyoid nodes, level 4. This is the one. Also known as the lower deep cervical nodes, located where the omohyoid tendon crosses the lower part of the internal jugular vein. Next is upper posterior triangular nodes, level 5A. It is in the posterior triangle of the neck between the sternocleidomastoid muscles and trapezius muscles and above the accessory nerve. Lower posterior triangle nodes, level 5B, this is the one. It is in the posterior triangle of the neck between sternocleidomastoid and trapezius muscles and below the accessory nerve. Anterior compartment nodes, level 6, in the anterior compartment of the neck, here, inferior to the hyoid bone and superior to the suprasternal notch. Finally, paratracheal nodes, level 7. It is inferior to the suprasternal notch, deep to the manubrium sternum, and inside the superior mediasternum. Lymphatic drainage of the tongue. Although the tongue is a small structure, it has many parts. Lymphatic drainage of one part of the tongue is not the same as that of the another part. Most of the lymphatic drainage of the tongue converges towards and follows the venous drainage. However, lymph from the structures in the anterior part of the oral cavity runs an independent course, not following the venous system. Number 1. Lymph from the tip of the tongue, frenulum, and central lower lip runs an independent course and drains into bilateral submental lymph nodes level 1A after piercing the mylohyoid muscles. So from the tip of the tongue will go bilaterally to the submental lymph nodes. From here, some of the efferent vessels drain to the submandibular lymph nodes, that is level 1B mainly. Some crosses the hyoid bone and drains into the jugulo-omohyoid nodes, that is the lower deep cervical nodes, level 4 nodes. It may also drain into all the deep cervical lymph nodes along the internal jugular vein. They are level 2, level 3, and level 4 nodes. The anterior 2/3 of the tongue, that is posterior to the tip of the tongue. It is subdivided into two lateral marginal parts, LM, one on each side, and the central part, C. Lymph from the right and left lateral marginal part drain to the ipsilateral submandibular lymph nodes, that is level 1B. From there, they drain into jugulo-omohyoid nodes, that is lower deep cervical nodes, level 4 nodes of the same site. You can see here, from here, lateral marginal part drained first to the submandibular nodes of the same site, and from there it drained to the jugulo-omohyoid nodes. In this diagram, this is anterior 2/3 of the tongue. This is median septum of the tongue. Central part of anterior 2/3 is 12 mm on either side of the median septum of the tongue. This thing is the central part of the anterior 2/3. This is coronal sections of the tongue. This is a pair of genioglossus muscle, extrinsic muscle. This is a pair of intrinsic muscle, that is superior longitudinal muscle. This is the median septum of the tongue. 12 mm on either side of the median septum is the central part of the anterior 2/3 of the tongue. Now lymph from the central part, C, of the anterior 2/3 of the tongue, that is between 12 mm on either side of the medial septum, descend between the genioglossus muscle and drain bilaterally into the jugulo-omohyoid nodes, so that it drains to both sides, both jugulo-omohyoid nodes, that is level 4. This is posterior 1/3 and root of the tongue. Lymphatic from the posterior 1/3 and root of the tongue drains bilaterally into the jugulo-digastric nodes, that is upper deep cervical nodes, level 2. From there drains to the jugulo-omohyoid nodes, that is lower deep cervical nodes, level 4. All the lymph of the tongue is believed to eventually drain through the jugulo-omohyoid nodes, that is lower deep cervical nodes, level 4, before reaching the thoracic duct on the left or right lymphatic duct on the right and entering the respective site of the venous system. This is schematic diagrams of overall lymphatic drainage of the tongue. This is tip of the tongue. This is anterior 2/3 of the tongue. This is lateral margin, and this is central part of the anterior 2/3 of the tongue, which covers 12 millimeter on either sides of the median septum. This is posterior 1/3 of the tongue. This is submental lymph nodes, level 1A. This is submandibular lymph nodes, level 1B. This is jugulo-digastric nodes or upper deep cervical nodes, level 2. This is jugulo-omohyoid nodes, lower deep cervical nodes, level 4. Lymph from the tip of the tongue bilaterally drains to the submental nodes. From there, drain to submandibular nodes of both sides, and then to the jugulo-omohyoid nodes of both sides. And from anterior 2/3, the lateral margin will drain ipsilaterally to the submandibular nodes. And from the center parts will drain bilaterally to the jugulo-omohyoid nodes, that is the lower deep cervical nodes, level 4. From the posterior 1/3, bilaterally as well as ipsilaterally will drain to the jugulo-digastric nodes, that is upper deep cervical nodes, level 2. From there, it will drain to the jugulo-omohyoid nodes, that is lower deep cervical nodes. On the left side, it will drain to the thoracic duct, and on the right side, drain to the right lymphatic duct, and from there, they will drain to the venous system of the respective site. Clinical interest. In the posterior 1/3 of the tongue, there is rich anastomosis of the lymph vessels across the midline of the tongue. Hence, cancer on one side readily metastasizes to the lymph nodes on the same side as well as to the opposite side. Therefore, the prognosis is poor in cancer of the posterior 1/3 of the tongue. In the anterior 2/3 of the tongue, if the cancer is within 12 mm away from the midline, it metastasizes to the lymph nodes of both sides. Therefore, the prognosis is poor in both cases, the posterior 1/3 of the tongue and near the midline in the anterior 2/3. If the cancer is at the lateral margin of the anterior 2/3 of the tongue, it will spread to ipsilateral lymph nodes only. However, at the later stage, cancer may extend and becomes closer to the midline within 12 mm range. Then it commonly spreads to the opposite side also. The end. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.